not just a story. We're not just headlines. We're people.
We now know who patient zero is for the recent spread of the hantavirus, but investigators are now questioning ground zero.
Everybody keeps saying, sink the boat, sink the boat, sink the boat. The boat's not the problem anymore.
$640,000 in 24 hours. That is how much all of you pledged to donate to a legal fund to sue the F out of these hantavirus people.
We now know who patient zero is for the recent spread of the hantavirus, but investigators are now questioning ground zero. This was 70-year-old Leo Shipperud. He was an ornithologist. If you don't know what that means, they study birds. They study every aspect of birds. And if you'll remember, investigators were saying that this was likely picked up in Argentina when Leo and his wife Miriam were doing some bird watching and then also visited a landfill. Now, if you're wondering why they visited a landfill, there is apparently a specific type of bird that feeds on rodent droppings that are always at landfills. Let's back up again about ground zero. Originally, it's been thought of that ground zero was this area where Leo and his wife went bird watching. However, the apparent type of rat, the Calilargo rat, which carries the virus, is not in that area. They were in northern Patagonia 25 to 30 days before coming. They're now saying this is almost certainly where they contracted the illness. They arrived March 29th for this ship. So they only had 2 full days before boarding the ship, and the incubation period is at least a week. And remember, it goes up to 45 days. So the problem herein lies now that there would appear to be a whole different set of contact cases that now need to also be investigated. Also, just to reiterate, the ship will be docking Sunday in Tenerife. Since come out that everybody that is repatriated to their countries will be quarantined up to 45 days.
Hantavirus is not the next COVID-19, and I get the PTSD is flaring. There's some real trauma from COVID. I get it. These are very different situations, even though some of the things you may be hearing on the news have like some similar vibes to the beginning of COVID. We're in a very different situation from that. Hantavirus is not that common, and obviously the Andes strain even less common, and the only one that we know of that can spread person to person. But there have been outbreaks before, and in Argentina they see about 100 to 200 cases a year. There is still no treatment, there is still no vaccine, but this is still not COVID. COVID was a brand new virus. It mutated super easy, it spread super easy, and we hadn't treated it before, so we didn't know the best way to treat it. To quickly summarize and oversimplify, 1 to 2 people were exposed to the virus before they got on the ship. When they got on the ship a couple days later, one of them got sick and ended up passing away. The other one got off the ship, started to travel, and then other people on the ship started to get sick. Then a bunch of people got off the ship because they were like deuces, and they went back to their countries of origin on airplanes, which... and then there's still some people on the ship that are, or like they're getting off the ship and they're going to be heading home. The whole idea right now is that we need to be doing contact tracing to try to figure out who is exposed, make sure that we're quarantining and isolating and testing those who need to be tested. But right now what it feels like is the news cycle is moving super quick. There are multiple moving parts, multiple different countries involved, and that all sounds like a lot. Let's all stop and take a deep breath together. Panic is rarely productive. So right now what we need is not to panic. It's important to be aware of what's going on and to kind of keep an eye on it, and masking and social distancing are always great ways to protect yourself from infectious diseases. Washing your hands frequently is always a good idea, and if you're going to be on a plane, train, or an automobile for a long time with somebody you don't live with, it's probably a good idea to wear an N95.
And just when you thought the hantavirus was terrorizing us enough, here comes the norovirus trying to steal the show. Now, the good news about the hantavirus is that the 9 cases that we have been watching for the last week has remained at 9, and there have been no additional cases of individuals with the hantavirus. Now, yesterday we talked about how the hantavirus was being monitored in Georgia, Arizona, and California. And just today, the World Health Organization also stated that Texas and New Jersey are monitoring individuals who have come in contact with it, not infected, but in contact. Now, fast forward to, well, this morning, 115 people have been sickened on the Princess Cruise. You see the Caribbean Princess cruise with the norovirus. Now, according to ABC News, about 100 people on that boat of about roughly around 3,000 people have been stricken with the norovirus, which includes 102 passengers and about 13 crew members. So far, the symptoms, as you guys know, diarrhea, vomiting, fever. Now, that ship, the Princess one, is scheduled to be docked in Florida on May 11th, so just make sure you mask up. And as far as the hantavirus, just make sure, again, if you're going into spaces that are going to be tightly packed, like meetings or flying anywhere, just make sure you mask up.
I'll pick up the phone. They saying there's hantavirus in France right now, and the man who got it wasn't even on that fuck ass ship, okay? I'm not telling you to panic, but I'm fucking scared because the way that we only found out this was hantavirus 5 days ago, but this has been going on for a full month is actually kind of scary. It sounds like the ship set sail like beginning of April. Couple days in, there's a crew member who goes home to Switzerland to take his God-given PTO. I know that's right, King. And then a week later, there's a 70-year-old German man who passes away. I think he's German or Dutch. He passes away. 2 weeks after that, him and his wife get off the ship and they board a flight, a commercial flight, mind you, to Johannesburg, South Africa. She gets to South Africa and collapses and passes away a couple hours later. They have no clue that this is hantavirus, and we're like 3 weeks into April at this point. The same day that she leaves or the day that she collapses, there's a British man on the ship who gets sick with the same symptoms, pneumonia, fever. They thought it was like some cruise ship shit, but turns out they're like, no, this is not what it is. He also gets evacuated a couple days later to South Africa on a commercial flight, mind you. So we've got the guy in Switzerland who left, the German man and his wife that got on the Johannesburg flight, and now the British man who got on the Johannesburg flight. 4 or 5 days after the British man gets to Johannesburg is when they find out that this was hantavirus. And while it's been running through the world like a Tomb Raider for the past couple of days, you tell me not to panic when we know what we know here in America and they don't give a fuck. Guys, we're so fucked.
I'm seeing the most wild numbers thrown out there for hantavirus. There's 8 cases, 5 confirmed, 3 suspected. The flight attendant is PCR negative. The French man who was also on the flight is not positive. We do not know if he's positive or negative yet. And I beg of people to stop saying that everyone told us to not freak out about COVID. That's not true. All the people we should have listened to told us to act appropriately, and people didn't. Doctors must and do change guidance based on how people react and how things evolve. That does not mean doctors were wrong or gave you false information. It often just means the guidance has changed based on evidence. Freaking out does nothing. Wearing a mask does almost everything in this case.
We're not just a story. We're not just headlines. We're people. People with families, with lives, with people waiting for us at home.
I am sharing this in the middle of trying to breastfeed because this is a very scary story right now. This man is trapped on a ship with several hundred other people, and there's hantavirus on this ship. The ship has docked. They're not allowed to get off of the ship, and this is extremely scary, you guys. Like, this could send us into another COVID. Now, a lot of people are kind of joking around like, oh, I'm glad I never got on, I'm broke again, that wins. But listen, as that man said, they're not just a headline. These are not just stories. We need to talk about this because if these people do not get better, which this is very contagious, and they cannot control the outbreak, there is going to be an issue on our hands. And we could potentially be looking at another COVID. As much as I love a good hee ha ha, we need to look at this. I'm sharing his story. I'm following. I'm going to tag him. I want everybody to start talking about this ship and what's happening with these cruise passengers right now.
The CDC is now calling a deadly hantavirus outbreak a level 3 emergency. That means the risk to the general public is low, but the situation's being actively monitored. The cruise ship at the center of the outbreak is now headed to Spain's Canary Islands. Officials there say they'll perform careful evacuations. Meanwhile, health officials are reporting 13 suspected or confirmed cases and working to contain the outbreak around the world. ABC's Andrew Dimbert is here with more on all of that. So, Andrew, what's the latest on these new suspected cases? And how are those patients holding up?
Yeah, let's start with that British man who was hospitalized in South Africa, originally said to be in serious condition. Now he's improved to stable condition, so that's promising there. A Swiss national in Zurich is in the hospital, said to be in isolation protocols, while another patient who was airlifted off the boat is being treated in the Netherlands, also now this morning said to be in stable condition. And a German national was just recently moved to a different hospital in Dusseldorf. The death toll here remains at 3, and of course all 3 of those who died from the hantavirus were aboard that expedition cruise ship at one point or another. Here in the United States, 7 Americans are currently just being monitored. None have experienced any sort of symptoms of the hantavirus. They're not said to be sick. Right now they're back in their home states of Texas, California, Arizona, Virginia, and Georgia. Of course, they too were aboard this ship at one point or another. They're only being monitored. They're not sick. And the reason that they're being monitored is because health officials, out of an abundance of caution, are watching over them because that they say this virus, this Andes strain of the hantavirus, has a 6-week incubation period.
And there's no treatment, there's no vaccine. So how else are they trying to contain any potential spread?
Well, first, they're also trying to calm the public here and remind everybody that first and foremost, it is difficult and extremely rare for this Andes strain of the hantavirus to spread human to human, though they do believe, health officials do believe, that's what happened here aboard that cruise ship. As you mentioned, the CDC issuing a level 3 response. That is the very lowest level of an emergency activation. It signifies that the risk to the public is low, but still warrants some attention by health officials. Worldwide, health agencies are conducting contact tracing with anyone who may have come in contact with those infected. As for the ship itself, it'll anchor off the Canary Islands Sunday. It's not going to dock. Then all of the passengers there will wear hazmat gear. They'll be transferred by a small boat from this cruise to shore and then fly back to their home countries where they'll be subject to protocols there. In the UK, for example, they're asking all British passengers to self-isolate for 45 days. And then it's just carefully monitoring the situation, whether people are infected or not, while trying to help those who are infected recover.
My thing is, why would y'all let these people off the boat? Now they talking about in New Jersey, 2 people have been potentially exposed to this virus. If it's 2 people, then these people, if they've been around other people, then a lot of people are exposed. And I'm hearing some folks who got off that boat, they went to Georgia too. Why did y'all let these people off the boat? What are we gonna do now if there's some kind of outbreak in New Jersey or Georgia? Yeah, I should have let them stay on the boat. This is like COVID 2.0 all over. Potentially, this could be.
So you know how they've been telling us that this virus has been spreading due to infected rats? Well, guess what? They just did a whole inspection on the ship where all those 100 people are, and they did not find one single trace of a mice, of a rat, any droppings or anything. So now they are saying that this is the Andes virus because it goes from human to human and it starts from respiratory droplets. The fact that not one rat was found on that ship and the Andes virus comes from Argentina, which from where the ship was traveling from. And I'm genuinely surprised that they are letting the ship dock in Spain. Some people were saying to the ship, some people were saying to Titanic the ship, and I don't blame them. I mean, it's only 100 people on that ship. If that spreads hundreds of thousands of people, we will have to go right back into quarantine. I mean, we just got relief from corona, just. And now for this Andes virus, I mean, they don't even know what this shit is for real. Every single second they're saying, oh, it's because of this. First they said it was because of the infected rat, and now they're saying it's from human contact, from respiratory droplets. I mean, it's basically like fucking COVID. It's crazy. Don't be surprised. Y'all see what's going to happen in 2-3 weeks, and yeah.
Everybody keeps saying, sink the boat, sink the boat, sink the boat. The boat's not the problem anymore. The problem is the 23 people that got off that boat 2 weeks ago. Yeah, 23 people who live across the globe, mind you, got off that boat and went on about their business. Traveling, continuing trips, going to work possibly, who knows? Those 23 people carried on with their lives for the last 2 weeks, almost 3 weeks, and did not know that they had came in contact with this virus. Those 23 people, including the one man who's from Switzerland, who is now currently hospitalized because he has the virus and took it home to his wife. Those 23 people live in Switzerland, France, the UK, the United States of America, Canada, Australia, Taiwan. The boat is no longer the problem. The spread has begun. Now we pray.
What the fuck you mean? There's an airborne rodent disease that's killed 4 people on a cruise ship that got a 40% death rate. and they trying to figure out what to do. Figure out how to lead their ass out there. That's what you need to figure out. A 40% death rate? Let me help y'all with that decision. Sink that bitch. Sink that bitch. And from what I hear, tickets started at $13K. If you got $13K for a ticket, you can live 2 years on an island. Take their ass to a random island for a couple of years. They can start streaming. They could be the new Gilligan's Island. This is not the time to be bringing back a boat full of people who could possibly be carrying the hantavirus with a 40% death rate that already killed 4 people. It's too much shit going on in this country. I'm sorry if it's your family members, but this shit is bigger than feelings. Say y'all goodbyes till they get this shit under control. We ain't dealing with no another coronavirus. Hell no. Don't bring them back here. Don't bring their ass back here.
While we were sleeping, it was decided that the American passengers aboard the cruise ship will be taken to a military base in Nebraska to complete their mandatory quarantine. This is all thanks to President Fernando of the Canary Islands, who refuses to let the ship dock unless every single country agrees to repatriate their citizens and hold them in a mandatory quarantine for global safety. At this time, it has not been made clear whether the people that have already returned home that were requested to self-isolate will also be moved to Nebraska, as we're getting reports that the person in Arizona is refusing to self-isolate. This is a matter of global safety, and hopefully President Trump will give us more clarity today at the press conference.
We have some huge updates on the hantavirus outbreak. 2 New Jersey residents who were not on the ship are currently being monitored for hantavirus after suspected exposure. That makes it the 6th state that's monitoring a potential outbreak, along with Arizona, California, Georgia, Texas, and Virginia. The World Health Organization just issued a warning about the hantavirus outbreak, and the CDC just classified it as a level 3 emergency response. We don't know the full extent of the outbreak yet, considering symptoms can take up to 6 weeks to show. Experts are saying this is an extremely rare strain of the virus that can be transferred from human to human. 3 people have died already, and 8 others are currently sick, with a 50% chance of survival as there is no treatment for this virus. Here's what Trump has to say about the outbreak.
It's very much, we hope, under control. It should be fine.
Should Americans be concerned that it's going to spread? And how are you working to get those Americans home?
We'll do the best we can.
Not only did 23 people leave that ship. Yeah, that number is now 40. Not only did 40 people get off that ship in the Canary Islands 2 weeks before we knew it was hantavirus, those people have now gone home, and yes, they've gone home to the U.S. We thought we only had to worry about 2 people from that cruise ship in Georgia, but now we've got to worry about people in California and Arizona, all while the number of infected people has officially climbed to 11. And according to Good Morning America and ABC7, there was a Dutch flight attendant who came in contact with one of the ladies who passed away, and she's starting to have symptoms. Isn't that perfect? So as a precaution, she's isolating, and they're checking up on her. Great. Well, now they've got to check up on the 88 people that lady came in contact with on that plane. So between that and a number of other places across the globe, the World Health Organization is working overtime to make sure that we catch this thing so it doesn't cause another pandemic. Because y'all have already proven that you can't follow instructions, you can't listen to people who know what they're talking about, and you can't be bothered to care about your fellow man. So if this goes down again, we already know what's up. So for the love of God, we need to make sure that this thing doesn't spread. Now they're saying the good thing is, even though this is the Andes strain of the virus, which is transmittable from person to person, it is also still very hard to transmit this. Unlike COVID, it takes prolonged contact to be able to spread this kind of thing. So with that being said, they're calling this a low threat. Listen, I'm not telling you what to do. All I'm saying is a low threat is still a threat, and it will be treated as such by yours truly. With that being said, I do encourage you to prepare in the ways that you deem necessary. As I always say, if you stay ready, you ain't got to get ready. So do with that what you will and move accordingly.
What you mean that 2 people that got off of the Hanta cruise came to New Jersey? That they're from New Jersey and they let them come back? That they're not showing no symptoms and they got to self-quarantine? That the Board of Health is going to monitor them? Ustedes cabrones better not be walking around going everywhere knowing that you're supposed to be quarantined for 6 to 8 weeks. Going out shopping, because I know you got money. You was on that cruise. I know you got money. And you're probably the type of person who's going to be like, I'm not going to wear a mask. I'm not showing symptoms. We're fine. And then 2 weeks later, está muerto, pendejo. Don't be walking around spreading them damn germs. Because we're all right here. We're all right for now. And supposedly, it's not easy to get it. They said we shouldn't be worried. We heard that before. But now you 2 that were on the cruise are back in Jersey. Mind you, you came either through Newark International Airport, JFK, or LaGuardia. Did you have an N95 on? Because if you did it and you got the virus, that means you don't spread it around already. Don't be coming up in here messing up our summer. Because we not having it. We not having it. Stay your ass home. Keep your culo at home so that we could all be safe. Don't be selfish. Because you probably them type of people. You know who I'm talking about. Anyway, quédate en la casa, puñeta. Ya tú sabes.
Okay, guys, more updates from my sister who's on that cruise. Yes, that cruise. This is how she responded to all of your guys' comments.
OMG, guys. Thanks for all the support. We are doing okay on the ship. Low-key scared shitless, but we are doing fine. I heard people escaped. I didn't know that was allowed. Lol.
Hantavirus will spread. It absolutely will get worse. We are underprepared, we are underwarned, and we are under-resourced. You've heard of this cruise ship. It docks in Spain on Monday. 3 have already passed. 5 are confirmed sick. Dozens, potentially carrying a virus that we know spread person to person, are jumping off a cruise ship in just a few days. That has happened before exactly once in recorded history. I'm Rick Pescator. I'm an ER doctor, former state chief physician. I'm the editor-in-chief of Emergency Medicine News. I helped lead the national COVID response, both its wins and its failures. 30 passengers have already gotten off this boat. 6 are in California and Georgia and Arizona for a virus that hides in the body for up to a month and a half. We may not know who's infected until June. We didn't learn shit from the pandemic. We didn't build the system that's supposed to catch this. We took it apart. Every ER doctor in the country is supposed to get an alert when this happens. It's called a HAN, a Health Alert Network. But no alert has been sent. In March, the CDC quietly paused 20 tests for rare viruses. They've lost 3,000 employees. The disease detectives who are trained specifically for this, they're gone. We spent $1 trillion after COVID. We bought machines for viruses we already knew. We did not build what matters, the ability to make a new test fast when something shows up. There's a cruise ship right now in the Atlantic that's telling us that the lights are off at the CDC in Atlanta. This will spread, but we will find out late because the people who have been paid to watch have been told to
$640,000 in 24 hours. That is how much all of you pledged to donate to a legal fund to sue the F out of these hantavirus people who are coming back to America and not quarantining. That is how much the American people don't want to go through another pandemic. I am not making this up, guys. You guys pledged $640,000. It is going up every second that I'm looking at it. I don't want to show you the form because I don't want to violate anyone's privacy, but I mean, here's a spreadsheet. I scrolled this all the way to the bottom so you wouldn't see anyone else's information, but $640,233.21. That is what it is right now. And we currently have 7,998 people signed up. We're about to hit 8,000 actually. We did it. We did it. Oh, we just surpassed it again. 641,285.21 now. Up, going up again, going up again. You guys think I'm playing around. And you know what? This is a Tuesday for me. This is regular. This is community organizing. Keep in mind, this is all pledge money because I'm not accepting money from anyone unless we really need to go to court over here. I'm not catching any grift or allegations. I'm just saying this is the amount of money that this community is pledging because we don't want another pandemic. These people's names are not public right now. And again, I am not asking for anyone to be doxxed or harassed. We are using legal methods here. But if you are one of these individuals, you've probably seen my face by this point, and choose wisely what you're about to do next.